Taking your blood pressure medication the very first thing in the morning might be quietly destroying your ability to achieve a natural erection, and almost nobody is warning you about this. Think about what you did today. You woke up, walked straight into the kitchen, poured a cup of coffee, and swallowed that little pill. Why? Because the sticker on the plastic bottle says so, or because a doctor told you to do it during a rushed 10-minute appointment 3 years ago. Then the evening comes around. The mood is right. You expect your body to just do what it's supposed to do, but absolutely nothing happens. Or it sort of happens, but it feels weak, half-hearted, and completely frustrating. You immediately start blaming your age. You blame the stress at work, you blame your partner, or you look in the mirror and decide you're just broken. But look at the mechanics of this. Your body doesn't run on a perfectly flat line all day. When you force a heavy cardiovascular drug into your bloodstream at the exact wrong hour, you choke off the micro-vascular pathways required for an erection. You are literally turning off the main valve to the very pipes that need fluid pressure the most later in the day, all because of a scheduling mistake. This tiny, automated part of your morning routine, something you do to keep yourself alive and protect your heart, ends up acting as a silent saboteur of your sex life. It leaves you sitting on the edge of the bed with a mountain of unanswered questions and this heavy, isolated feeling that ruins your confidence before the day even starts. You are left wondering why your vitality is suddenly gone, completely blind to the fact that the chemical peak of that pill was perfectly timed to paralyze your natural biology. Before we dissect exactly how to fix this without messing with your heart safety, do me a quick favor. Drop a comment right now with your city and where you're watching this from. I check these comments constantly, and seeing where everyone is tuning in from helps me realize how big this community is getting and reminds me why we need to keep pushing for honest answers about male vitality. I'm Dr. David Chen, and I spend my life dealing with men's health and longevity. Every single week, I sit across from guys over 40 who are doing everything right. They eat clean, they hit the gym, they try to manage their sleep, yet they are quietly suffering through this exact same nightmare in the bedroom. They sit in my examination room, look at the floor, lower their voices, and tell me they feel like a shadow of who they used to be. And almost every single time, when we lay out their daily schedule, we find the exact same blind spot. They are managing their heart health with military discipline, but their timing is completely fighting their natural biology. It honestly breaks my heart, because I see these men carrying this massive weight of shame and avoiding intimacy altogether, sacrificing their relationships and their peace of mind, simply because the standard medical system treats every patient like an identical, generic assembly line machine, instead of a living organism with a strict internal clock. Let's be completely honest about how a standard doctor's appointment works these days. You get 10 minutes if you're lucky. Your primary care doctor checks your arm, sees a high number, writes a script, and tells you to take it in the morning so you don't forget. They care about your systemic numbers, which makes sense. Preventing a stroke or a heart attack is the priority. Paralyzing your personal life is just a secondary detail. But what they never have time to sit down and map out with you is that the balance between keeping your main arteries safe and allowing your pelvic blood vessels to dilate is incredibly fragile, and it changes by the hour. Your body follows a strict circadian rhythm. It dictates when your hormones spike, when your blood pressure naturally climbs, and when your vessels are supposed to open up. When you drop a massive chemical dose into your system without looking at that clock, you cause a massive internal collision. Your doctor gets to look at a pretty number on a chart during your next checkup, but they don't see the empty, collapsed pathways in your lower abdomen that have been entirely starved of the blood flow needed for a normal life. Think about your heart and blood vessels like a massive plumbing system in an old house. If you want to get water to a tiny, distant garden hose at the absolute edge of the backyard, you need a specific amount of baseline pressure moving through the main water line. If the city comes along and turns down the main street valve to the absolute bare minimum, the water will still crawl through the massive central pipes to keep the house from burning down. But the pressure at that tiny, distant garden hose drops to zero. In your body, Your erectile tissue is that distant garden hose. Achieving a firm erection requires a massive, incredibly rapid influx of blood. The local vessels have to open wide, while your systemic pressure drives that volume forward. If your blood pressure medication hits its absolute maximum strength in your bloodstream at the exact moment you need that localized rush, the plumbing simply cannot deliver. Your main carotid and femoral arteries are perfectly safe, but the specialized capillary network inside the corpora cavernosa stays empty and flaccid. The pressure gradient is so precise that even a small artificial dip in your baseline driving force during those critical hours makes physical expansion impossible, no matter how much mental desire you have. Here is what gets completely left out of the conversation in traditional medical offices. The peak concentration of a morning dose hits your bloodstream at the exact time your body tries to experience its natural daily testosterone surge. For healthy men, testosterone peaks in the early morning hours. That's the whole reason morning erections happen in the first place. That hormonal surge is designed to prime your vascular system, telling your endothelial cells to release nitric oxide, which is the chemical key that unlocks and opens your blood vessels. When you swallow a fast-acting blood pressure pill right when you wake up, the drug absorbs rapidly and slams into your system just as that natural expansion is trying to take place. You are stepping on the gas and jamming on the brakes at the exact same moment. The drug blunts the natural elasticity of your arteries, completely overriding the vitality signals your body worked all night to build up. If you keep doing this month after month, year after year, those vessels in the pelvic region actually begin to lose their ability to adapt to sudden physical changes. You develop a sort of chronic vascular stiffness that becomes incredibly difficult to reverse, simply because you've spent years chemically suppressing your body's natural morning awakening response. To understand why this is so dangerous, you have to look at how these chemicals actually move through your body after you swallow them. Most common blood pressure pills don't just work instantly and disappear. They take about 1 to 4 hours to reach their absolute peak level in your blood. So if you take your tablet at 7 in the morning with your breakfast, your system is flooded with the maximum concentration of that drug by 10 or 11 a.m. This completely flattens your blood pressure curve during the exact hours you are active, moving around, and supposed to be maintaining natural vascular tone. By the time the evening rolls around and you actually want to relax and connect with your partner, your body has been living under a state of heavy, artificial suppression for 12 hours straight. The smooth muscle cells lining your arterial walls are completely exhausted. They become entirely unresponsive to the neurological triggers of intimacy. You sit there mentally aroused. Your partner is right there with you, but your vascular system is still locked down by a chemical peak that happened hours ago, leaving your body physically incapable of moving blood where it needs to go. And it gets worse when you look at how specific classes of these medications mess with your nervous system. This isn't just a simple fluid pressure issue. It's an electrical communication failure between your brain and your pelvic floor. Take beta blockers, for example. They work by forcing your heart to slow down and reducing the force of its contractions by blocking adrenaline. That is great if your heart is overworked and failing, but it also completely mutes the parasympathetic nervous system responses that are mandatory to trigger an erection. Your brain needs to send a sharp, crystal clear signal down your spine, telling the smooth muscle tissue inside the penis to relax so blood can rush in. If a beta blocker has your nervous system in a state of chemical sedation, that message just gets lost in transit. The wire has been cut. This nerve blunting effect creates this awful, disconnected feeling where you are completely present in your mind, but your body feels like an unresponsive piece of wood. It turns what should be a natural, spontaneous moment into a stressful, analytical science project where you're just waiting for a signal that has been chemically blocked from arriving. Then you have diuretics, or what most people call water pills. These are some of the most commonly prescribed first-line defenses for high blood pressure, and they are absolute killers for male performance. They lower your pressure by flushing out fluid, reducing your total blood volume, so there's less tension on your arterial walls. But an erection is entirely a fluid-dependent event. If your total circulating blood volume is intentionally drained to its absolute lowest point, your body struggles to fill that cavernous tissue. On top of that, diuretics strip your body of essential minerals like zinc and potassium. Zinc is the literal blueprint your body uses to manufacture testosterone. When you run low on zinc, the luteinizing hormone production in your pituitary gland drops, which pulls your natural testosterone levels down even further. You end up in this horrific physiological trap. You have less fluid volume in your pipes, less testosterone in your system, and a lack of intracellular potassium. Your body simply does not possess the raw physical materials or the fluid mechanics required to sustain a firm erection. When you try, you get a partial, weak response that instantly kills the mood and sends you straight into a state of panic. The only reason you were told to take these pills in the morning is patient compliance. That's it. It's not because it's better for your body. It's because doctors know you're more likely to remember a pill if you take it right next to your toothbrush or your coffee. It is a decision made for administrative convenience, entirely ignoring a man's sexual health, his confidence, and his mental well-being. When medical protocols value easy habits over complex human physiology, you are the one who pays the price. You end up with these massive side effects that get misdiagnosed as just getting older, forcing you to accept a degraded version of your life. We have to stop looking at this through the lens of generic, one-size-fits-all medicine. Your masculinity and your relationship should never be treated as acceptable collateral damage just to make a clinic chart look clean. If you look back at why morning dosing became the rule, it's honestly ridiculous. Decades ago, clinical trials were designed around when doctors worked. Patients came into the clinic between 9 in the morning and 5 in the evening, so researchers measured blood pressure during those exact hours. They told everyone to take their pills in the morning, so the numbers would look perfect when the patient sat in the office chair. This created a massive systemic bias in medicine. It established a multi-generational habit that completely ignored what happens to your blood pressure while you are sleeping, resting, or trying to be intimate at night. The system optimized for the convenience of the medical chart rather than the actual lifestyle and happiness of the human being taking the drug. This is where chronotherapy comes in, and it changes everything. Chronotherapy is just the science of timing your medical treatments to match your body's natural internal clock. Real clinical research in cardiovascular medicine has shown that for a massive number of long-acting blood pressure medications, shifting your dose to the evening actually provides way better protection against nighttime hypertension and morning strokes, while completely freeing up your daytime and evening hours for natural vascular performance. Think about what happens when you take that pill before bed. The drug absorbs and reaches its highest, most intense concentration while you are completely unconscious, doing its heaviest lifting while you sleep. By the time you wake up the next morning, and definitely by the time you reach the afternoon or evening of the next day, the medication has passed that aggressive chemical peak. It still maintains a safe, protective baseline for your heart, but it finally steps out of the way, allowing your local blood vessels to regain their natural responsiveness when you actually need them. Look at what this does to your body's morning safety. Cardiologists talk constantly about the morning surge, this dangerous sudden spike in blood pressure that happens right before you wake up, which is statistically when the highest number of heart attacks and strokes occur. When you take your medication at night, you blunt that exact dangerous spike while you sleep. Then, as dawn approaches, the drug starts clearing out of your system naturally. Your nitric oxide pathways can open cleanly, your cortisol and testosterone can rise without interference, and your morning physiology is driven by your own hormones instead of being crushed by a chemical blanket. You let your body experience its natural vascular resets, preserving the long-term elasticity of your arteries and protecting your performance from dying out prematurely. This is especially true if you are on angiotensin II receptor blockers, which people call ARBs, or ACE inhibitors. These specific drugs work by stopping a hormone called angiotensin II, which is the chemical your body uses to squeeze and narrow your blood vessels. By blocking it, your arteries stay relaxed and open. The clinical data shows that when you take an ARB at night, it doesn't cause those sharp, terrifying drops in local pelvic pressure that you get with a morning beta blocker or a heavy water pill. Instead, it creates this smooth, continuous stabilization of your endothelium, the delicate single layer of cells lining your entire vascular network. This continuous support actually helps repair vascular damage over time. It ensures that when your brain sends the signal for an erection, your blood vessels have the physical flexibility to expand instantly without hitting an artificial chemical wall. They protect your heart while actively maintaining the exact plumbing mechanics you need to function like a man. To really appreciate why this matters, you have to realize that your endothelium is the intelligent control center for your entire blood flow. It monitors every single change in pressure and releases nitric oxide on demand to widen your vessels whenever a muscle needs oxygen or when intimacy requires blood to pool in the pelvis. When you flood those delicate cells with peak medication levels every single morning, you dull their natural sensors. Over time, that lining gets lazy. It completely loses its ability to auto-regulate. It literally forgets how to dilate on its own without a chemical push, which leads directly to long-term erectile issues that stick around even if you skip a pill for a day. Shifting that dose to the evening breaks that numbing cycle. It lets your endothelium wake up, breathe, and practice doing its job naturally during your active daylight hours. Think about the natural behavior of blood pressure at night. In a healthy guy, blood pressure naturally dips by 10 to 20% during sleep. This nocturnal dip is mandatory because it gives your heart a rest from the high-pressure stress of daily life. But a huge number of men with chronic high blood pressure are what we call non-dippers. Their pressure stays dangerously high even while they are asleep, which shoots their risk of a cardiovascular event through the roof. Taking your pill at night directly corrects this non-dipping problem, forcing your body into that safe, healthy nighttime valley. The beautiful irony here is that by treating the most dangerous window for your heart, the nighttime plateau, you completely lift the artificial chemical weight from your daytime hours, allowing your natural masculine performance to return without putting your life at risk. I want you to look at your prescription bottle tonight in a completely different way. Stop looking at it as this rigid, terrifying set of rules that you have to obey at the expense of your life, and start looking at it as a tool that can be optimized. If your current medication schedule leaves you feeling fatigued, kills your drive, or creates intense vascular resistance during the day, your body is screaming at you that your schedule is out of alignment. Now, I need to be completely clear about this. You should never coldly change your medication routine on your own without a precise, guided conversation with your doctor. You don't just stop taking heart medication, but you need to walk into that clinic armed with the right questions. Go to your next appointment with a clear understanding of your own data. Look your healthcare provider in the eye and ask them if switching to an evening schedule or exploring a different class of medication, like an ARB or an ACE inhibitor, is safe for your specific heart profile. Make it clear to them that while you value your longevity, you are absolutely not willing to quietly surrender your masculinity, your confidence, and your relationship to an unoptimized compliance schedule. When you sit down with them, demand a 24-hour ambulatory blood pressure monitoring test. It's a very simple diagnostic where you wear a small cuff for a full day and night. It lets your medical team see exactly when your numbers peak and when they drop in real-world scenarios, not just inside a sterile clinic room. If your data shows your pressure is perfectly fine at night, but spikes during specific daytime hours, your medication timing can be adjusted with absolute precision. This moves your healthcare away from lazy guesswork and pulls it into personalized, high-performance medicine. You stop being a passive bystander who just swallows whatever falls out of a plastic bottle, and you become an active manager of your own biological machine. You ensure that every single medical intervention serves both your long-term survival and your current quality of life, turning your treatment plan into a bespoke strategy designed to help you thrive rather than just coast along. We also have to address the massive psychological toll that this timing error takes on a man, because it ripples into every single area of your life. The very first time you experience a vascular failure in the bedroom because of a misplaced medication peak, your brain doesn't think about pharmacology. It instantly internalizes that failure as a personal defect. You tell yourself you're losing it. This triggers an immediate wave of intense performance anxiety, which activates your sympathetic nervous system, flooding your body with cortisol and adrenaline. Adrenaline is a natural vasoconstrictor. It is the exact chemical your body releases when it thinks a tiger is chasing you, pulling blood away from your extremities and shunting it into your core to keep you alive. So the anxiety caused by that initial morning pill creates a secondary mental barrier that makes future erections even harder to fill, creating this vicious, self-feeding cycle of failure. Breaking that cycle requires a clean physical intervention. You have to fix the timing of the drug to gain the mental clarity that comes from realizing your body isn't actually broken. You have to stop blaming your manhood for a mechanical failure that was entirely programmed by an arbitrary morning schedule. Think about the invisible weight you carry when that cycle takes over your head. You start avoiding intimacy completely. You make up excuses about being exhausted from work, or you stay up late sitting on the couch watching mindless television just to make sure your partner is dead asleep before you walk into the bedroom. This avoidance builds this silent, heavy wall of resentment and emotional distance between both of you. It leaves your partner feeling completely rejected and unattractive, and it leaves you feeling deeply insecure, emasculated, and totally alone. Then it bleeds into your career. Your performance at work starts dropping because your brain is constantly looping through the anxiety of your perceived physical decline. You stop showing up at the gym because you feel completely disconnected from your own physical body, totally unaware that this entire cascade of emotional, social, and physical degradation started with a simple, easily correctable timing error in your morning routine. When you fix the clock, you don't just fix a vascular plumbing mechanism. You completely dismantle the psychological trap that has been draining the joy out of your life for years. Stop accepting the outdated lie that turning 40, 50, or 60 means you just have to watch your physical power and your intimate health slowly wither away. Your body is an incredibly adaptive, resilient system that responds directly to how you treat its internal mechanics. When you finally understand how cardiovascular pharmacology intersects with your natural male hormones, you reclaim the power to direct your own aging process with dignity and raw strength. Managing your blood pressure numbers should protect your lifespan, but it should never require you to compromise your masculinity or give up on your quality of life right now. You deserve a health strategy that treats you like a whole man, protecting your heart, honoring your vitality, and preserving the physical expressions of connection and confidence that define who you are. Do not accept lazy protocols, do not settle for partial answers, and never let a standardized compliance routine dictate the boundaries of your personal happiness. If this kind of deeply researched, completely honest breakdown of male vitality is what you've been missing in your health journey, clicking subscribe takes 2 seconds and ensures you'll never miss the crucial breakdowns we are covering next week.